Welcome to Mary Washington Hospital, and thank you for choosing us for your procedure. The video you're watching will provide information about each step of your surgical journey and the progression of activities you'll be taking towards improved health and a better quality of life. We're here to keep you and your caregivers informed every step of the way. Now let's get started. Once your physician has scheduled your surgery, please call centralized scheduling at 540-741-2000 for a pre-admission testing appointment. On the day of your appointment, you will receive a phone call from a nurse who will interview you about your medical history, any past surgeries you've had, and the medications that you take. Your surgeon may have you come into pre-admission testing to bring in your pre-operative paperwork and to complete any pre-operative tests, which will need to be completed ideally 7 days prior to your procedure and no less than 3 days before surgery. Depending on the type of surgery you are receiving, you may be asked to come in and see a nurse practitioner in addition to the nurse phone call. During this on-site visit, you'll be given a complete physical. You'll discuss your health history and receive pre-operative education about when to stop eating and drinking, what time to arrive for the surgery, and you'll receive directions about medications you may take on the day of surgery. At this on-site appointment, we can complete any physician-ordered additional testing, such as labs, EKGs, or X-rays, prior to your procedure. Additionally, the nurse practitioner may identify specialists that need to be seen. Whether you receive a phone call or come in to visit with the nurse, it's a great time to ask questions. On the day of your surgery, please arrive on time. As you enter the hospital, patient registration is located on the left side of the lobby. You'll be asked to provide identification, and we'll collect a copay if appropriate. A volunteer will escort you to the surgical waiting room on the second floor. A nurse will come to retrieve you, and your family or friends will wait in the surgical waiting room while you are prepped for surgery. You may be given a bear hugger gown to wear that feels a bit like paper, but it's attached to a heater hose that will keep you warm and comfortable. Once settled in, you'll meet your team that will be working with you. This is composed of an anesthesiologist, an IV therapist, and nurses who will be with you. At this time, a family member or friend may be allowed to stay with you until you are wheeled to the surgical suite. Sometimes your surgery may be delayed, but we do our best to keep you informed. All surgeries are unique, and sometimes emergencies happen, so we appreciate your patience. Once it's time for your surgery, we will wheel you into the surgical suite, and your family or friends will be asked to provide a cell phone number so that we can keep them informed on your progress on an hourly basis. After the surgery is completed, the surgeon will meet with your family or friend in a consultation room to provide an update. You may still be in the operating room or the recovery area, also known as PACU, but for your safety and theirs, your caregivers are not typically allowed to join you until you are comfortably settled in your hospital room. Please note that you may be in recovery for a while, as it sometimes takes a while to prepare a room for you. Unlike a hotel where you have a room waiting for you, a hospital sometimes can become very busy without notice, and rooms may not be readily available. While you wait, we'll be keeping you warm and comfortable in the PACU. Once you arrive in your hospital room, the nurses will show you how to operate your bed, which will move up and down, recline, and sit up. Most people experience some level of pain, so we will help you manage this pain in the hours following your surgery. Nausea and vomiting occasionally occur after surgery, so don't be alarmed if this happens. We will help you with medications to ease your discomfort. Assistance is available to help you get in and out of bed, sit in a chair, take deep breaths, and cough. Once in your room, your family and friends are welcome to visit. Typically during your stay, you may receive a visit from one of our hospital leaders who will ask you questions regarding your experience at Mary Washington Hospital. We value your feedback, and this is a perfect time to voice concerns or compliments. Before you go home, please make arrangements for a responsible adult to transport you. During discharge, a nurse will review instructions and the medication list with you. If you or a family member have questions, please be sure to write them down during your stay and present them to a nurse, physician, or leader prior to your discharge. We are here to help, and we want to make sure that you clearly understand how to reach your goal of improved health. Within 24 to 48 hours after discharge, you will receive a call from a Mary Washington Health Link nurse who will be checking on your progress. We want to thank you again for choosing to have your surgery at Mary Washington Hospital. Our goal is to always be there for you and provide a positive surgical journey that opens doors to an improved quality of life.